My 15-year career in nonprofits, it actually started as a love letter to Black women. I grew up in a very large family. If you include the siblings of my grandparents on both sides and all of their lineage, you get the population of a small city. If you count my mother, my grandmothers, and all of my aunts, I was raised by 15 Black women. And growing up, watching their strength, their fortitude, and just how they navigated and conquered systems that were not made for them, it truly inspired me. It made me believe I could do anything, even change the world. Growing up with this example, it's no surprise that I became an activist. And as a baby activist growing up in a large, diverse family, I was able to bear witness every day to how our systems failed us. And after 15 years of mission-driven work, the world that I want to live in is one that centers people living on the margins, those that lack access to opportunity, who are often ignored by society, in many ways by design. This system of organizations that is supposed to address this opportunity gap for marginalized communities is the nonprofit. And when using the nonprofit playbook, mission is king. Many of us who end up working in nonprofits, we do so because of an attraction to mission. However, like many systems, the nonprofit system is plagued with inequity. I got my start in nonprofits as an HIV testing counselor. It was in the mid-2000s when the country was experiencing a second wave of the AIDS crisis. Some of my friends were getting sick. Some of them were also dying. And this was at a time when there were supposed to be medications and resources, but my community wasn't getting access to those resources. So I was like, what can I do? How can I help? So I became a volunteer. And on my first day as a volunteer HIV testing counselor, one of the first people I tested came back positive. She was a young Black single mother. She was in her 20s, in her mid-20s, like I was at the time, and she was on her lunch break from work. The plan was to come in, get a test, get out. When I went in and told her her results, she seemed dejected, but there was something off. I could tell something wasn't right. So I asked her, what do you need right now? How can I help you? I don't know if it was me or if it was just the weight of it all for her, but she began to open up. She told me she already knew that she was HIV positive. Her doctor had told her recently that she was undetectable, and she thought that meant she no longer had HIV. So she was coming into the agency to get a test to have proof that she no longer had HIV, so she could go and show her family, because they were forcing her to sleep in her car or in a makeshift tent in the backyard, and they were keeping her from her family, from her children. The family was just so afraid to catch it. There was even a set of dishes with her name on them that only she could use. I was shocked. I didn't know how to respond. They didn't quite go over this in the volunteer orientation. And truthfully, when I looked at her, I saw those 15 Black women. And I just thought about all the struggles and all of the ways in which they had to overcome just to live. So I broke down. I hugged her, we cried together for a moment, and I was just thinking, what can I say? What can I do to give this woman hope, to give some information for her and her family? I told her, you will always have HIV because there is no cure, but undetectable is a good thing because it means your medications are working. And it also means you can't pass this to anyone else. She thanked me. She ran out the door back to work. When I went and told the nonprofit staff what happened, they were sympathetic, but they were also surprised and they were a little upset. They felt like we had wasted resources by giving her a test. And they were upset because her test wouldn't count as a newly diagnosed case in the community. You see, nonprofit systems operate under a lot of rules and regulations. It's almost like an algorithm built on an equation that is really right now, unfortunately, centers people who are funders and philanthropists over the systems, over the people the systems are meant to serve. The power to fund often creates the power to defund. And this is known as the nonprofit industrial complex. It's a phrase that was coined in 2004 by a group called Insight, a Women of Color Against Violence collective. When applied broadly and without intention, the nonprofit industrial complex, it starts to create and decide who can get their services and their needs met and who cannot. And then this ultimately what happens is the system then determines who is valued and who is unworthy. For that mother I spoke of, the algorithm wasn't able to compute the value of her needs. The staff were sympathetic, but the system simply didn't allow for her to matter. So let's think of it a different way. Imagine you're in line at a concert. It's your favorite artist. You've been waiting a whole year to see this show. Let's just pretend the artist's name rhymes with the word Beyoncé. You get to the front of the line, you give them your ticket, the usher, they ask for your zip code. And you're like, well, why are you asking for my zip code? But you give it to them anyway, because you want to get into the show. And they reject your ticket. They tell you you cannot come in, you're not eligible to attend this show. And they tell you it's because the person you bought the ticket from, they didn't tell you that only people who live in that city and have a zip code in that city can attend the concert that night. And you travel from out of state to see the show. So you leave dejected, you're devastated, you're thinking about all the time, the money, the resources, the energy it took you to get there. And you say, you know what? Concerts are just not for me. I'm never seeing a concert again. And you don't. There was a system of rules and regulations in place that you were not aware of that kept you from that experience. And also, it kept you from wanting that experience ever again. Imagine the concert venue is a nonprofit. The artist is the service you so desperately need. And that ticket and the associated restrictions represent all the barriers, the regulations, the rules of the nonprofit industrial complex. The woman I spoke of earlier, she got all the way to the front of that line, but couldn't get into the concert. The system simply wouldn't allow for her needs to get met. I believe it is my job as a nonprofit leader to disrupt algorithms that devalue marginalized communities. What if we could create a system that automatically provided resources for those with the most need? There are nearly 2 million nonprofits in America, but there are still so many people whose needs are not getting met. 2 out of 3 nonprofits said just last year they could not meet the need of the services they provide. If we think about that, and then you also dissect it even further and do some research, you see that the people that are not getting their needs met, they live at the intersection of race, gender, and income inequality. But there is hope. It doesn't have to be this way. I've been lucky enough to be a part of many initiatives that have worked to disrupt the nonprofit industrial complex. One example was when I had the opportunity to work on a project where the government was providing funding to address HIV in Black and brown communities. Myself and a group of activists, we decided we're gonna do things differently. We're gonna flip the algorithm. So we decided to do surveys within the community we were planning to serve and ask them, what do you need? What services would you like provided? This was sadly a novel concept 10 years ago. We then built community centers that met their needs and provide the services that they said that they wanted. And then when they came in and got services, once we met their need, then we provided community health workers to provide healthcare as well as HIV prevention education. And what you started to see across the country where these community centers existed, there were decreases in the HIV positivity rate amongst Black and brown communities. And you also saw increases in the number of people who living with HIV that access care. Building community trust became the algorithm. When nonprofits center the most marginalized or those who are the most vulnerable, it really has the opportunity to heal families and save lives. I want you to stop and think about the services and systems that you interact with daily. Are those services easily accessible to the most vulnerable among us? Think about who sits furthest from that service. Is the person in your community that's low income, doesn't have the means, doesn't have transportation? Can they easily access that service? If the answer is no, we need to start asking why. And we must start holding nonprofit leaders and funders accountable. It's time we change the algorithm. When you center a policy, procedure, or program around those who are the most vulnerable or most marginalized, what you automatically do is create opportunity instead of barriers. When you create a solution that works for the most marginalized, you create a solution that works for us all. It is my dream that we start changing this algorithm by centering people over funders. Because when nonprofits do this, we have the opportunity to do something that's never been done before. We can actually create a system that automatically produces opportunity for all. And that's how we end epidemics. That's how we heal families. That's how we save the nonprofit from itself. But most importantly for me, it's how I make 15 amazing women proud of me. Thank you.